Hello, everyone. We are starting our webinar on ethical aspects on volunteering and exchanges. This webinar is actually dedicated to the International Volunteers Day, and we are here today for you. By we, I mean Giorgia Solda, the Scopi External Development Assistant from CIS in Italy. Hi, Giorgia.
Hi, everyone.
Also, we have here Javier Shafika Spura, the SCORI External Development Assistant from IFMSA Honduras. Hi, Javier.
Hello, everyone.
We also have Irvin Barbosa Molinas, the SCORI Director from IFMSA Paraguay. Hi, Irvin.
Hey, guys. Good to see you here.
Yes, thank you, Irvin. And it's me with you as well, Tanya Zebrova, the SCOPI Director from HCCM Russia. So today we are here because it is the International Volunteer Day, and therefore we are using this occasion to speak about IFMSA exchanges, and specifically about professional and research exchanges in IFMSA. Our focus today will concentrate on the ethical aspects of both of them. This webinar is going to be quite short, so don't worry, we will not take a lot of time from your schedules, and what is more important, we will have a question time in the end. So in the meantime, during the webinar, you will be able to write down your questions. If you are curious where you can do it, just look on your right, the screen, and you will see the question tab there. And we will answer your questions in the very end of the webinar, so feel free to do it. We really hope that you will enjoy this webinar and that you will spread the ideas of ethical exchanges around the world and through with your students and your local officers around the world. So, Georgia, next slide, please. So, yes, today is the 5th of December once again, and this is the first time we're having this campaign, let's say. So we are going to deliver you the following messages. Next slide, please. So our exchanges are professional experiences, academic electives, so they may seem to have nothing in common with volunteering. So why are we speaking about it today? Actually, there is way more linking that it seems to be from the first sight. At the ground of both of them, there is the ethical aspect, that the values that lead our way to both acting as half volunteering or doing an exchange as a student. Next slide, please. So speaking about ethical volunteering, we need to add to that concept of volunteering the motivation principles, values, and beliefs that guide one's actions while taking part in a volunteering exchanges. So what does it mean actually for us? Here then comes the link with our exchanges, medical ethics. Since we conduct our exchanges in the medical field, we should speak about ethical exchanges and therefore medical ethics. And medical ethics is literally described as a system of moral principles that apply values and judgments to the practice of clinical medicine and in scientific research, and to which professionals can refer to in the cases of any confusion or conflict. Next slide, and I'm giving the stage to Irvin.
Yes, thank you very much, Tanya. So as a very important part of what are ethical exchanges and what is ethical volunteering, we need to talk about ethics and 5 principles that we have within medical ethics. As you may all know, these 5 principles are A, B, C, D, E, that stand for autonomy, beneficence, confidentiality, do no harm, equity, and equality. I'll explain them very briefly so you get to understand a little bit better what they mean. Autonomy stands for the freedom of informed decisions that patients or people can make. And so this principle of autonomy views the rights of an individual to self-determination. Autonomy has become more and more important as social values have shifted to define medical quality in terms of outcomes that are important to the patient and their family rather than the medical professionals. When it comes to beneficence, refers to the actions that promote the well-being of others. Basically, it stands for doing the right thing. In medical context, this means taking actions that serve the best interests of patients as well as their families. However, there is some uncertainty that surrounds the precise definition of which practices do in fact help patients. And that's when sometimes lines can be blurred out or there are gray areas. But the main idea stands that it's about trying to do what's best for the patient. The letter C, we have confidentiality. Confidentiality is commonly applied to conversations between doctors and patients. This concept is commonly known as the patient-physician privilege. There are legal protections and there are laws that actually will prevent physicians from revealing their discussions with patients, even under oath in court. And we will tackle this issue also later, speaking about the selfie campaign. The D stands for do no harm, also known as the non-maleficence concept. Non-maleficence is embodied in the phrase first do no harm, which is probably a phrase you might have heard in medical career, primum non nocere, which stands for first we do not harm. Many consider that should be the main or primary consideration. That is the most important thing first, to do no harm to your patient rather than to do them good. And this is partly because there are many practitioners that are prone to use treatments, or they're very likely to use treatments that they believe will do good without having evaluated to ensure that they do not harm the patient. And a lot of harm has been done to patients as a result, as in the saying, the treatment was a success, but the patient died. It is not only more important to do no harm than to do good, it is also important to know how likely it is that your treatment will harm a patient. And then you have equity and equality as the last part. This is also one of the main reasons that leads people to volunteer and what leads our actions. As doctors and as future physicians, we are looking forward to have equity and equality, not only in society as a whole, but also in the health sector, hoping to ensure better people's lives. Equity is the absence of avoidable or remediable differences. So basically, it stands for trying to bring the playing field even and trying to give to each person how much they need. Health inequities therefore involve more than inequality. That inequality means that nobody has the same with respect to health determinants. There is also access to resources needed to improve and maintain health or health outcomes. They entail a failure to avoid or overcome inequalities that infringe on fairness and human rights norms. To reduce the health inequities is really important because health is a fundamental right, and its progressive realization will eliminate the inequalities that result from differences in health status, such as disease that produces disability and therefore affects the productivity and overall well-being of the society. Then we will move on to the next slide. Javier?
Thank you, Erwin. So talking about what is IFMSA's position about ethical medical placements abroad, it mentions basically that despite the positive effects, medical placements abroad do not undergo the same rigorous analysis as other parts of the medical curriculum, especially if we talk about terms of learning processes and the outcomes of them. So many medical students going on placement abroad have commendable motivations, but they actually lack the necessary skills to learn and contribute most effectively while away. Outside of the IFMSA, there is also no specific consensus or official guidance, if you could say so, on the required content of pre-departure training, particularly on the field of global health ethics. We believe that this is a life-changing experience for many exchange students. Without careful preparation, students can act without competence, negatively affecting the well-being and trust of hosts. All students who are participating need to be aware of the possible effects towards the local community or local health professionals. This is why the IFMSA calls for an international debate about the structure of these placements, in order to have a more rigorous standardization of pre-departure training, the objectives, and the assessment of international exchanges and electives. As you may know, within IFMSA, evaluation of the placement is done through completion of the mandatory evaluation form and the exchange and scientific report for scope and score respectively after each exchange. This important aspect allows reflection and feedback on the exchange by the student in order to continue to improve IFMSA exchanges, and the data available could be used to evaluate the impact of IFMSA exchanges on the student's personal and professional development. This bilateral model, with appropriate evaluation and follow-up, can be used as an example of a sustainable and equitable method of providing medical placements abroad. Also, there are some cases in which NMOs are not able to open opportunities in case of any major circumstances, for example, security issues in the country. Therefore, even though bilateral exchanges are the core of the IFMSA as they promote equitable opportunities for students of both countries involved in the placement, we must not neglect the unilateral opportunities, which thus help to truly promote equity in exchange opportunities worldwide. You can move on, and I will leave you with Gio on the UNESCO PDT.
Hi, everyone. So let's speak about what we as IFMSA do to assure quality and ethical internship. First of all, we try to select motivated and capable students. We take in great consideration also the language level, and not only English, but in those cases then when French or Spanish is required, we also find students that can really. Then we stress the importance of the global aspects of internship. So we want the students to understand that it is not just an elective, but it is also a cultural and social experience. And so also all the ethical aspects are really important and not just the academical one. Then we assign a tutor, so a local doctor, to every student. So no one is at risk of doing something that he or she cannot deal with, and they can also learn more, both from the academic and also from the cultural point of view. Then, as Javier was mentioning, we have this evaluation form for the students to fill, and for students of obviously who took part in the exchange. And but time by time, we know what we improve, we know how to better. And in the end, we try to create a welcoming environment and assure a group of local students that can take care of exchange students for the entire period of the exchange. And for that, we have to thank all the members from all the local committees around the world that can take care of the students during their 4 weeks experience. And when do we emphasize these concepts? We have special moments, both for outgoing students and incoming students. We call them pre-departure trainings, and they are targeted to our outgoings or incoming students, so before or after their exchanges. In particular, a great collaboration we had with the UNESCO chair in bioethics. We worked with them in the last years, and together we created a toolkit for the local organizers of the exchanges to help them organize these pre-departure trainings. So the training for the outgoing students. And this is focused especially on the ethical aspect of these experiences. So the IFMSA pre-departure training, as said, is endorsed by the UNESCO chair in bioethics, and it has been pioneered with a goal of increasing students' ability to face both ethical and so in the host countries with confidence, and it also meant to, in the end, to protect patients they encounter. So in the training does this by exposing students to ethical and cultural realities that are different from their own. That's the important part, because the students go to a country and to a cultural setting they're not used to. And then by opening a dialogue through which students are able to identify their own personal bias and treating patients. And we hope this process contributes to the development of a generation of future physicians, better skilled at treating patients from cultures different from their own. And we think this is crucial in the context of a world in which health issues are increasingly transnational. If you want more information about this topic in particular, please check the event post and IFMSA official website, and you will find the whole toolkit with manuals and slides and so on. Thank you. I'll pass now the floor to Erwin.
Thank you, Georgia. So about the topic that I mentioned earlier before about ethical selfies, I would like to make a little quote before we move on, and that's a very short and simple one that states, "Think before you snap that selfie." And it may sound a little bit short and even funny, but it actually has a very deep and true meaning to it, that it's a really serious message that is not only believed by us, but has also been the words of a joint campaign created by two groups that have spent the past few years poking fun at problematic photos taken by Western volunteers who have gone abroad to do their volunteering. Many journalists wrote about it. You might have seen it in the news. You might have heard about it from someone, just like us. And this is having a very deep underlying situation, and it is about a trend that we can see quite often among students that go for an elective or go for a volunteering opportunity abroad, where they paint themselves as saviors to needy people in low income countries or in risky situations. There was this campaign that was launched last year in this period that offers guidelines created by RadiAid. That is a project from Norwegian students and Academics International Assistance Fund, or SAIH, that fights stereotypes in aid and development, and by Barbie Savior, that is an Instagram parody account, and you can actually look it up if you want to see what I'm talking about. We are speaking about these topics because we believe that this is something really, really important to our exchange students, and we believe that every exchange student should know about this, and they should be aware of them. We also spoke about confidentiality before, but we should probably also talk about some legal aspects. If you take a picture of any patient that you're working with, is it really ethical? And not only ethical, is it legal? No, it actually isn't, because you are invading that patient's privacy and intimacy. And you're probably breaking some laws too along the way. So please think twice before doing it. Tanya, you are going next. Thank you.
Yes, thank you, Irvin. I just wanted to add to the previous slide that Irvin was talking about, and to add to that, just think about yourself. Imagine how comfortable would you feel if someone was taking a selfie of you being sick or being in a very uncomfortable situation. This is always the best policy. Just judge on how would you perceive the actions taken towards yourself that you're going to take towards someone else. And this all brings us to the final culmination point. So what should we do? How should we behave? How should our students behave during exchanges? There are definitely things that exchange students abroad should do and things that they should not do. One of the examples of inappropriate action is doing invasive procedures with less supervision than at home school, or in order to increase self-experience. So, for example, if you were doing something in your med school under the supervision of the doctor, and then you're coming to for an exchange to another country, and with the more freedom that you feel within yourself, you're trying to do more, and even without the supervision of someone, this is definitely not right. This is not how it should work. However, you still can do several things. For example, listen to a heart murmur. A local doctor has diagnosed it, and the patient has given the permission. So, see, the key points are the diagnosis was already given by the doctor, the permission was given by a patient. You can also present, for example, present a case study to fellow students of a patient seen during the rounds with local healthcare workers. So again, you went through a round with the tutor, supervising doctor. You saw some cases, and then you discuss those cases together with the tutor and with your fellow students. This is how you can learn. Another example is conducting a chart review to help the clinic understand incidence of high blood pressure. So again, you're conducting a review under a supervision of the some representative from the hospital. Um, just to add to that, I want to mention that those examples were mentioned from the CUGH recommendations. If you want to learn more, if you want to know how to be more ethical during exchanges, if you want to know what to tell your students, please feel free to check our infographics that we shared with you in Instagram and on Facebook on our event, on our campaign today. So to draw the conclusion, what can we all do to promote and implement the ethical aspects to our exchanges and medical placements abroad? We consider that there are at least three parties that should contribute to those actions, and they are NMOs, universities, and all the students that are going for exchanges. So, from the NMOs, we expect support towards IFMSA exchanges, which can be done through economical support, helping with materials, helping with resources, the work that can be done to implement pre-departure trainings and upon arrival trainings that will educate students and they will behave in an ethical way during their exchanges, which may prevent a lot of conflicts that may raise up if this is not done. Another action point is to host trainings at national and local levels on how to maximize the benefit of medical placement and abroad and to improve the quality of exchanges. And as already mentioned before as well, organize pre-departure trainings and then upon-arrival training sessions, including the topics on personal issues, travel safety, cultural awareness, language competencies, and international ethical considerations. Those things are really vital for students to be fully equipped while going for exchanges. What can we ask medical schools and universities to provide us with? We can ask them for recognition of IFMSA exchanges, and you know that this is the topic that we are addressing a lot during this term and during the previous terms as well. So if medical schools recognize IFMSA exchanges as part of the medical curriculum, it will ease our job a lot, and they can also provide us with some materials and some support to tackle this question in a more qualified way. Medical schools can ensure the educational opportunities of local students are not disturbed by the students on medical placements at the institution. It can provide fundings to students' destination for tuition if medical placements abroad are compulsory part of an institution's medical education. So this is, you see, this is the idealistic future that we hope will happen one day, and we're really working towards it. Also, med schools can work with governments to advocate for visa provision for students. This is also a topic that goes along with all the exchanges discussion. And they also can invest in research of the impact that medical placements abroad have on hosting communities. So feel free to go to universities and feel free to ask for help to analyze the evaluation forms filled by the students, especially when we are because we are now moving to the part of pre and post evaluation, which can help us to make a real impact assessment on of our exchanges. And of course, what should students do, and what do we expect them to do while being on exchanges? To understand their role as a learner within the new health system and not as a health professional who is meant to provide care. That was already mentioned that students tend to overestimate their knowledges and uh, mm, their actions while being on exchanges and while doing voluntary work. And sometimes it may seem to be that you're the hero that come for an exchange and you can save everyone, which can unfortunately lead to very sad circumstances. So estimate yourself according to your abilities. Then we expect medical students to adhere to international medical ethics codes. So if you are not sure if the things you are doing are ethical or not, just remember the ABCDE concept and evaluate and just lead your thoughts through those letters as the filter, and this may help you to make a decision. Never exceed the level of skill appropriate to the level of training that was already mentioned above, and avoid being judgmental to or different medical practices or beliefs abroad, and seeking to integrate new healthcare perspectives to their practice within their home country. So this we can sum up with the words: respect the healthcare system of both the host country and your country, um, and always take the best, but always consult with someone more professional in order to either go this way or not. And this actually finishes our theoretical part. And now we want to ask you if you have any questions. We will give you a couple of minutes for writing your questions on the right. Feel free to ask whatever makes you feel uncomfortable or uncertain. If you have any ethical problems that you don't know how to solve, or if something from the webinar was not clear for you, don't hesitate, we're still here. In the meantime, guys, do you want to add anything?
No, thanks, Tanya. I think all the things we said are really, really important and the core of our exchanges. So we really have to take them into consideration. If you are students or LEOs or laureates or IFMSA members or even university, just think about the ethical aspects of all the experiences and medical experiences abroad. And don't be afraid, ask questions now. We are here for you.
Yeah, thank you, Georgia. Actually, we're always for you for questions, there for you for questions. We know that some situations may occur unexpectedly, so don't be afraid to consult with the Scorpion Scory international teams or whoever you consider qualified on the topic. It's always difficult to make a decision on your own. Okay, I think we don't have any questions coming right now. However, you know that we are always in touch with you through all the means of communication, emails, Facebook, WhatsApp, whatever, Telegram, any means of communication and social networks. Feel free to contact us, and feel free to spread the idea of ethical exchanges within your animals, within your students, and within your medical schools, which is very, very important. We want universities to understand that we are taking this very serious. And I would like to thank everyone for listening to this webinar. And of course, I would like to thank everyone who was helping to present this webinar to us. So thank you, Irvin, Georgia, and Javier. And we hope that every one of us has become slightly more ethical by the end of this day. And I would say this is a goodbye from my side. See you later at the other webinars that we hope to have through this term.
Yep. Thank you very much, everyone. And we hope to see you somewhere around soon.
Thank you. Bye-bye.
Bye-bye.
Bye.
Thank you, guys. Have a great one.